Hi, I'm Teresa the Traveler, and today I'm at Skin Kamloops, my favorite beauty place, to get a vampire facelift. So I am not allowed to have makeup on, which I forgot. So I'm just gonna wipe it off. Get rid of all of it, including eye makeup. Now they're gonna put some numbing cream on me. Alright, the freezing's on. Now I just have to lay here for 30 minutes and let it take effect. I have recently got fillers in my face to help with volume, and this treatment works in conjunction with the fillers. Now the fillers, it goes in deep underneath your muscle and it helps plump out your face, but the vampire facelift, it works on the fine lines and the crepiness you get underneath your eyes to make the top layer of your skin look fantastic.
So with results with this, usually after the first treatment, you see about a 15 to 20% improvement. The second one, it's around 40 to 50. That third one is about 80%. If we're dealing with people with, say, acne scarring, sometimes 4 to 6 treatments is recommended. Whereas if we're just doing it for typical rejuvenation of the skin, we recommend a series of 3, and then maybe a repeat every 9 months for maintenance.
And how long between treatments?
4 to 6 weeks.
Okay.
So now's the part where I have to get some blood drawn. I'm a little bit afraid of needles. I don't really like this part, but I'll suck it up.
Nothing to it.
Okay, it wasn't as bad as I thought.
Nothing to it.
So how much blood do I need? Like just to fill up that little vial?
Tube. Yeah, just one vial.
Only one vial. That's not bad.
Okay, so this is your whole blood.
Yeah.
We're going to put it in the centrifuge, and this little gel stopper is going to come up, and it's going to put the red and white blood cells to the bottom and bring your platelets and your serum or your plasma to the top, and that is what we are going to inject back into your skin.
Alright, so my blood is now in this centrifuge, and it's spinning. How long will it spin for?
6 minutes.
6 minutes.
Your tip. So this is where we actually put the PRP into directly, and I'll show you.
What's PRP mean?
Platelet-rich plasma.
Ah, okay.
And then if you can see in here, there's 6 tiny little microneedles.
Okay.
At the RPM we have it set, it means each little microneedle goes up and down 150 times per second. So you're getting 900 little microchannels per second with this machine.
So you connect it to this
To this.
tube.
And then on here I have different needle lengths.
Okay.
So different needle lengths. This is your first time, so we're going to start at a conservative level. And then I read your skin. I look for skin response to know if I need to go deeper or not. So traditionally, like a forehead, we'll start at a 0.3. We can go up to about a 0.5 or 6. Whereas somewhere thicker like your cheeks, some people are at a 1 to a 1.3 millimeter needle length. And it actually sounds like an electric toothbrush. Feels like an electric toothbrush. It's a circular motion on your skin. Nice, clear, yellow, healthy PRP.
And all that's left is my red blood cells. What happens to that? Just throw it out?
Yeah, just throw it out. We just put it into our sharps. And then this here is your PRP. And this is what I inject right into here each time I fill.
What is that?
This is hyaluronic acid. This has got a bit of glycerin with it, but it acts as almost like a lubricant or a slip for the machine to run.
Okay,
Right.
so you're putting that on at the same time.
Yeah, this is directly going onto your skin. The PRP is being loaded into your tip. Goes in to there, and then it's delivered right into your skin.
Alright, so you said you're putting
Hyaluronic acid.
hyaluronic acid on my face.
Yeah. Which is basically, that's the component of any kind of filler out there on the market, is hyaluronic acid. Hyaluronic acid, there's 2 great things, well, there's lots of great things about it, but the 2 that we're concerned with here is as we age, hyaluronic acid is in every tissue, it's in our cells. But as we age, it depletes. And the nice thing about hyaluronic acid is it draws fluid and moisture into it. So as you're depleting it, you're losing that volume, and then you're losing your ability to draw moisture and water into the cells. So when we're infusing this back into your skin is nice and glowy. How's that feeling?
Actually, that doesn't hurt at all.
No.
That's
so,
it?
Yeah, so I'm just gonna do a small pass with you and just go find my end point. So you're gonna look red like a sunburn, and then we're gonna get some little micro channels of pinpoint bleeding. And that's how we know we've gone deep enough. So I'm just gonna grab my...
Yeah, getting a little red.
So I'm not seeing any pinpoint bleeding there yet, so we're just gonna bring you up one. Is there any concerns or areas that bug you more than others? I know you wanted to address just...
Yeah, my concern is under the eyes. Like,
Okay.
as I get older, I've noticed that that skin gets thinner. So will this actually make
Thicken
it not
up.
so thick?
Yes, absolutely.
Oh, really?
Totally, it will create collagen and elastin. It will help to retexturize this whole area because you've got a little bit of texture here. So as these little microchannels punch the skin out, that's going to heal together and create a tighter dynamic. And then we're actually stimulating, we're creating controlled injury. So when your body has controlled injury, it has controlled healing, which creates collagen type 1, which is a nice, fine, tight network of collagen and elastin fibers. So that's what gives you back the uniform tightness in your skin.
So to sum that up, I'm going to save money on concealer.
Yes.
So we're almost done my forehead, and the longer it's on, the more kind of pinchy and sandpapery it gets, but it's not super painful, just a tiny bit uncomfortable. So now we're doing under the eye. This is the part I am excited about. Alright, so definitely getting the sunburnt look now. But you said the sunburnt look will not last
So
for very long?
You're going to be really, really red, and then when we're done this, I'm going to put a hyaluronic acid mask on, which helps to kind of comfort the skin a little bit. And then you can probably get another big flushing in about 4 or 5 hours once all the numbing is gone. And you'll be probably the reddest tomorrow morning, and then it just subsides. Usually I find most people don't stay red past 24 to 36 hours.
So we're about halfway through my treatment right now. We've got the forehead, eyes, lips, chin done. Now we're just doing my cheeks. Each treatment takes approximately 45 minutes. So the treatment part is done. This is how red my face looks. And now we're just gonna put on a mask. Oh, this is my mask that you're sending me home with?
Yeah, so the blue part I'm gonna take off.
Okay.
I'm gonna fold that up into a Ziploc bag, and you're gonna put it in your fridge, and then you're gonna put that on whenever you're, the next 24 hours when you're feeling hot or uncomfortable. Now this is your mask. It's one size fits all, so we have to play a little bit. Ready? So I'm just gonna put it on you here, and you're gonna feel instant relief with this.
Oh, that feels a lot better.
Yeah, so just let me find your mouth here. Give me 1 sec. All right. One size fits all is not always great.
Now, how long does this mask stay on?
It stays on for about 25 to 35 minutes. It's gonna dry white, and then I just peel it off, and then you are on your way. So you're gonna see how much difference in the redness comes down after you have
this is gonna help take the redness out.
Takes the redness out and just calms the skin because you feel tight and sunburnt.
Yes. Now I'm getting a goodie bag that I get to take home with me. Aftercare kit.
So I have a little aftercare sheet. I'm gonna write your days and times in here for you. Extremely important for the rest of today, for 24 hours. Anytime you touch your skin, I want you to do it with a glove. We don't want any bacteria to get into all those microchannels that we just put into your skin. So I give you a couple gloves.
So yes, very important because she's put like a whole bunch of holes in my face now. So I gotta make sure that I'm not gonna get infected.
So if you got furry friends, keep them away from your face for today.
Okay, no kissing my rabbit Jack.
no, Jack is off limits. I want you to stay out of hot tubs, saunas, extreme exercise for 48 hours. Nothing that's going to make you sweat like crazy, because we don't want that bacteria to get into your skin.
Okay.
Pure hyaluronic acid.
Yeah.
And you just snap the top off and apply this to your face. This is going to really, the mask is made of hyaluronic acid. This is hyaluronic acid. So this is going to be your go-to.
And how often do I do that?
As much as you want. Probably 3 or 4 times today. In the morning, I'm going to give you, I have a cleanser here that you're going to wash your face with, and then continue on with this hyaluronic acid for tomorrow.
Okay.
And then on Thursday, we have a day and a night that we're going to want you to put on. So use this until you're done, and then you can go back to your normal skincare. I just strongly advise if you have anything aggressive like pure retinols or really strong vitamin C's, you probably want to stay off those for at least 7 days.
So it's a couple hours after my treatment, and already I notice the redness is going down, and the burning is not so ouchy anymore. So they gave me this other mask to take home. It's a blue one. I put it in my fridge, and now I'm just gonna wear it for a little bit to cool my face off some more. This is probably a procedure you want to have when you've got a couple days to yourself. It's not exactly pretty. Well, it's the next morning, so it's been 24 hours since I had the treatment, and my face, not red anymore. It's smooth, it's white, looking good. So it's day 2 after my treatment, and my face is not red at all. I do have some peeling going on right around here, which is a good sign. It means it's working. It's been about 2 weeks now since my vampire facelift, and my skin looks and feels amazing. And I got an unexpected result. For most of my life, I've had these calcium deposits under my eyes. They're now a thing of the past. And I still have 2 more treatments left to go.